The femoral artery is the main supply of the thigh. It enters the thigh from behind the inguinal ligament as a continuation of the external iliac artery. Here it lies midway between the anterior superior iliac spine and the symphysis pubis and can be easily palpated. Then it descends almost vertically toward the adductor tubercle of the femur and ends at the opening in the adductor magnus muscle by entering the popliteal space as the popliteal artery. Within the femoral triangle, the artery lies on the psoas, which separates it from the hip joint, the pectineus, and the adductor longus. Medially, it is related to the femoral vein, laterally to the femoral nerve and its branches. Here, the femoral artery lies superficially and is covered only by skin and fascia. In the middle of the thigh, the artery is overlapped by sartorius, passing via the adductor canal. On entering the thigh, femoral artery gives off four superficial branches: superficial circumflex iliac artery, superficial epigastric artery, superficial external pudendal artery, deep external pudendal artery. These arteries supply the skin and soft tissues over the lower abdominal wall and perineum. The profunda femoris artery is the large and important branch that arises from the lateral side of the femoral artery about 4 cm below the inguinal ligament. At its origin, it gives off the medial and lateral femoral circumflex arteries, which take part in the formation of the anastomosis around hip. Medial femoral circumflex artery passes backward between the muscles that form the floor of the femoral triangle and gives off muscular branches in the medial fascial compartment of the thigh. The lateral femoral circumflex artery passes laterally between the terminal branches of the femoral nerve. It breaks up into branches that supply the muscles of the region. Then the profunda femoris artery passes medially behind the femoral vessels and enters the medial fascial compartment of the thigh. During its course, it gives off 3 perforating arteries, which pierce the white tendon of adductor magnus and supply the posterior compartment of the thigh. It ends by becoming the 4th perforating artery. The descending genicular artery is a small branch that arises from the femoral artery near its termination. It assists in supplying the knee joint. One more artery supplies the medial compartment of the thigh. It is the obturator artery, a branch of the internal iliac artery. It passes forward on the lateral wall of the pelvis and accompanies the obturator nerve through the obturator canal. On entering the medial fascial compartment of the thigh, it divides into medial and lateral branches, which pass around the margins of the outer surface of the obturator membrane. It gives off muscular branches and an articular branch to the hip joint.